Okay, I'm going to give a lecture now on FMD signs and symptoms. Just 3 objectives. I want you to understand the difference between a symptom and a sign. You probably hear those all the time, signs and symptoms of this disease or that. Understand the common symptoms of fibromuscular dysplasia. And you're going to see information that is repeated in multiple talks today, but that's actually a really good educational tool to have repetition. Helps us to learn. And then understand when to seek medical attention. There's going to be another lecture on some of the complications of fibromuscular dysplasia, and I believe Dr. Morrison will be talking about those signs and symptoms. So let's do a Mentimeter. Which of the following is a symptom of FMD? A bruit, pulsatile tinnitus, a diminished pulse, or abnormal kidney function? Okay. I can tell it's a little bit of a harder question because there's less engagement. But it's okay. I can't tell who's picking what answer. You can pick anything you want. It's anonymous. Okay, so I asked, what is a symptom of FMD? The correct answer is pulsatile tinnitus. Here's why. By the way, all of those can be associated with FMD, but the only one that is a symptom is actually pulsatile tinnitus, because a symptom is a subjective evidence of disease. Okay, whereas a sign is an objective evidence of disease. So does that mean that a symptom is not real? No, but I can't measure your chest pain. Only you can feel your chest pain. And I can hear your pulsatile, I can hear bruit, that's a sign, but the pulsatile tinnitus is a symptom. So other examples of symptoms are headache, because I can't measure it. There's no test for me to do, or numbness. Whereas other signs of FMD, which are observable by others, are things like a bruit that I can hear, abnormal kidney function I can test on blood work, a diminished pulse that I can feel on your body, or certainly results of an ultrasound or a CT scan. Things like weakness are both a symptom and a sign, because you can feel it and I can test it. Okay. Here's oh, golly. Did you guys already do this? Place the following symptoms of FMD in order from most frequent to least frequent. Yeah. So pulsatile tinnitus, for those who may not know what that means, that's just that swooshing sound you can hear in your ear. And as Dr. Wells said, it's the turbulence and the fast flow of the FMD and the carotid passing by your ear. And it sounds like, okay, great. This group is so well educated. So the information I'm going to be showing about signs and symptoms comes from this first paper from the US FMD registry of the first 447 patients. And I have them split up by symptom and by sign. When it comes to symptoms, headache is the most prevalent symptom, followed by pulsatile tinnitus, and then other sort of neurologic symptoms like dizziness. Neck pain is also a very frequent symptom. When it comes to signs, high blood pressure is the most common, followed by a bruit that we can hear in the neck, then aneurysms and dissections. There are tons of other signs and symptoms, but those are a little less common. Which of the following is a symptom of an aneurysm? Select all that apply. Very good. This is what I like to see. Actually, all of them can be a symptom of an aneurysm, because symptoms and signs can occur together, but not all signs result in symptoms, sometimes until it's too late. So an aneurysm is a classic example of a sign, but you know what? Aneurysms are asymptomatic most of the time. And that's why we have to use things like CT scans, ultrasounds, and MRIs to detect them, because you have no idea if you have one or not. And that's why frequently when you go see a provider in FMD, we'll say, hey, I think it's a good idea to get a CAT scan from head to pelvis to make sure there's no aneurysm I need to follow over time. Because a brain aneurysm also can be asymptomatic until it gets too big, and then it can start causing neurologic symptoms or headaches. This emphasizes the need for a high index of suspicion, because we know aneurysms and dissections run along with FMD, and ordering the right tests. Symptoms of FMD vary by the vascular bed involved. So if you have a blockage, let's say in a kidney artery, you may develop hypertension, but the vast majority of hypertension in fibromuscular dysplasia patients is not from FMD. It's essential hypertension. It's the good old, I'm an American living in America, high blood pressure. And so that's why it's uncommon that you will need something like an angioplasty for your blood pressure, and we treat it with medications. Headache. We're going to hear a great lecture on headache, but I have no idea why FMD is associated with headaches. Is it perhaps a vascular manifestation? We don't have a real good test for intracranial fibromuscular dysplasia changes. Pulsatile tinnitus, that one I can tell you is associated with carotid FMD, or if you've had a carotid dissection. And then a lot of my patients say they have flank pain. I don't know why. FMD hurts sometimes, I feel like. You may have renal FMD. It really shouldn't hurt, but flank pain is very common. And then finally, neck pain. Well, is it really from the carotid FMD? Or is it that a lot of you in here are probably a little stretchy, hyperflexible? Those of us who are hyperflexible, because I am too, we get early arthritis. And sometimes maybe it's muscular, or I just cracked my neck doing that. Sometimes it's muscular, or sometimes it's, like your bones or your spine. And so you may have neck pain that may or may not be related to your FMD, or maybe it's related to the overlying disease process we've not yet identified yet that is manifesting in a vascular format as FMD, like a connective tissue, something or other. Okay. Oh, I put my red flag there. When should symptoms cause you to call your doctor or go to the emergency department? If it's a new symptom. So if you're a person who doesn't have a lot of headaches or neck pain, but you wake up one morning and you've got terrible headache and terrible neck pain, certainly if it's associated with other neurologic symptoms like vision problems or weakness or numbness on one side, I get worried about that. That's an ER visit. So if it's a new symptom or an abrupt worsening in a current symptom, then we get worried. All right, which of the following is a symptom of FMD? You got it right. Correct. The only one is pulsatile tinnitus. And that's all I have. Thank you very much.